Hi, our board of researchers have conducted a clinical trial that will try to cure and prevent cancer through the use of nanomedicine and nanotechnology. We were assigned a patient that was diagnosed with osteosarcoma at the age of 14 after developing pain in the knee joint and a limp. The patient was able to be treated with chemotherapy and surgery, and all the cancerous cells were gone, and the patient is now living a regular and happy life at the age of 21. So since our patient was already cured and he was fine and healthy, we developed a question on how to utilize nanotechnology in the battle of cancer. And our goal is to be able to silence the cancerous genes in the precancerous and cancerous cells while also destroying the cancerous cell altogether so that it can't affect surrounding healthy cells. So this nanotechnology medicine is going to work via surgery or injection, whichever we feel fits the participant more, or whichever they feel more comfortable with or would rather do. They both have the same effectiveness, so there is no difference in that. It's just a matter of opinion. So a nanotube will first be administered into the bone matrix so that it can go straight to the cells that cause osteosarcoma. And it is going to mark any mutation, should there be one, in the precancerous and cancerous cells, because the new nano device that we have created with an RNA interference is going to be attracted to that marking from the nanotube, and it's going to release a polymer strand with a water-based agent to silence the gene and destroy the cancerous cell, should it be cancerous. And since it is a water base, the cell will absorb it once it gets there, and it'll travel to the nucleus and silence the gene in the precancer cell, and if the cell's already cancerous, it'll be designed to trigger that cell into apoptosis so that it can die off and no longer affect the cell cycle of surrounding cells by overbearing onto them. And so it attaches the portion of DNA and it releases the strand that silences the gene by dissolving into the precancer cell and destroying the cancer cell. So the expression can never happen in the future, so there is no chance for cancer to develop at all. And it won't affect any of the other cells since it will be dissolved into the cell and be normal. So it is released again into the targeted cells with the surgery or the injection by the nanotube marking it, and then the RNAi goes into it and silences the gene, destroys the cancer cell. And here is a little example. We have our RNAi, and we can put that into a DNA plasmid, encoding it, and it will transfect into the nucleus of the cell, going to the portion that is cancerous and or precancerous with that gene, and it'll have a stable integration and expression once it does its job. Now, the known possibilities and risks are the off-target effects if the device doesn't completely adhere or dissolve. But we did take that into consideration when creating the device. Because it has the water base, it'll go through that semipermeable membrane anyway and be expelled naturally from the body, so it won't cause any adverse effects to the patient because they don't need any more effects if they're already having cancer or the potential to get it. And if that does happen, the device will still obliterate a cancerous cell, but if it can't adhere and silence the gene in the precancerous cell, it'll just be extracted from that cell and then expelled from the body naturally. And there's a very slim chance of the device not fully adhering and silencing the gene, but should that happen, it won't be a problem. We'll just have to wait a little bit and give them another injection and hope that that one does its job properly. So our purpose of this trial is to prevent the cancerous cells from affecting healthy cells and from the precancerous cells becoming cancerous. And the results should be promising because we have taken a lot of care and consideration into making sure that it is, but since it does have to be so careful and close to detail, we realize that there's might need to be extra work before proceeding to give this drug to the general public, because we have to make sure that there will be no problems and that it is extremely effective, because that's what they deserve as a patient with cancer. And this treatment is a lot better than the other treatments out there, for example, chemotherapy and radiation therapy, because these only target the bad cells. It only targets the cells that have the cancerous gene, and it only targets the ones that are already cancerous. It won't affect any healthy tissue or healthy nearby cells, only the ones that could cause a problem. And it gets rid of the cancer cells completely, and in the precancer cells it turns them off so that they become healthy and they don't have the chance to ever become cancerous, because that gene will no longer be on and it can't be turned on in the future. So it's a lot better because it's more effective, it's more efficient, and it does not destroy healthy cells and healthy tissues. This trial will be controlled. The researchers are going to know who's getting what, and the participants will know what they are receiving. We didn't find any reason to have it be where it was single blind or double blind. There was just no purpose to us in that aspect. We figured it'd be a lot better and maybe a little bit safer just to know what we were giving them and to have them know what they were getting, because that develops a seed of trust. Now, the requirements to be eligible for this trial: you need to be aged 13 to 23 and have osteosarcoma or the ability to have osteosarcoma. And if you are under the age of consent, meaning 18, you need to have a parent's guidance and permission, because nothing bad will happen. There's no way you're going to die from this, but it is very important that the parents are on board when you are not old enough to make a decision like this on your own. Now, if you have osteosarcoma, it is recommended that you talk to your doctor or your provider, your physician, to make sure that this is a good choice for you, even if you are of age to make your own decisions, because they have a better medical view on this. And if they think that you shouldn't do it, maybe you should listen. Of course, it is still up to you. It's just recommended that you talk to them before. And the assessment of safety for this trial is we're going to make sure that the drug is kept sterile and pure before administering it. We're going to administer with gloves, obviously. We're going to give everyone the correct dosage that they need. We're going to make sure that people who are qualified are the only ones that are getting it during these trials. We're going to make sure that there is no way for this nanomedicine to ever leave the facility, because that would be extremely bad should it get to someone else's hands or to the general public before it is completely finished. And we're going to give it a clear route through the injection or the surgery to make sure it only gets into the bone matrix, because it will only be looking for the osteosarcoma gene. And while it is able to be ejected from the body naturally, it would just be a lot better and safer if we made sure that it got to the correct region right away. And we also have that counteractive agent in the device itself. Should it not adhere or not go into the correct area of the body, it'll be expelled naturally and will not cause any adverse effects to the patients or the participants. We made sure that nothing could go wrong in this experiment. In that sense, we took a lot of consideration and precautions before we decided to give it to people. And that's our trial. Thank you very much.